To present to you my thesis, which brings two realms of medical field, which is psychiatry and ophthalmology together. Comparison of EDI-OCT features and anxiety scores in patients with central serous retinopathy versus controls. As we know, it is an idiopathic detachment of neurosensory retina because of pathophysiological changes at the Reich's complex. CSER is the archetype of pachychoroid spectrum, which was coined by Varro et al. In 2013. The major risk factors are stress and type A personality. Stress can be a cause as well as a consequence of sudden visual loss. And EDI-OCT enables us for a detailed evaluation of choroid and its vasculature. The primary aim was to compare the EDI-OCT features and anxiety scores between patients with CSER versus normal controls. The primary objectives were to compare the choroidal thickness and anxiety scores, and the secondary objectives were to study the other OCT features of CSER and to compare the demographics. It was an observational case control study. We recruited 100 unilateral cases of CSER coming to the retina services. 100 controls presenting to general OPD were recruited, which were age-matched and gender-matched. After consent, history, and slit lamp evaluation, a detailed EDI-OCT scan was taken of patients and controls, and anxiety scoring was done. The OCT parameters noted were choroidal thickness, subretinal fluid, pigment epithelial detachment, hyperreflective foci, and fibrin. We used the Hamilton Anxiety Rating Scale, which is a validated questionnaire consisting of 14 symptoms, and it is divided into 5 categories: not present, mild, moderate, severe, and very severe. As expected, 87% of the cases were males, and we took similar gender-matched controls. The average age in cases was around 39 years, and age-matched controls were taken. The choroidal thickness was, in cases, was around 448 microns, and in fellow eye also it was high, which is 398 microns. In controls, it was normal. Pachychoroid was present in 94% of the eyes with CSER and in 76% of the fellow eyes, thus reinstating the fact that it is a bilateral pathology. The other OCT features which were compared were, which were noted were subretinal fluid, PED, fibrin, and HRF were present in all the CSER eyes, while only 24% of the fellow eyes had a PED. Coming to the main part, which is the anxiety scoring, around 47% of the cases had moderate anxiety, 25% had mild anxiety, whereas only 7% had very severe anxiety. And in controls, 99% of the population didn't have any anxiety. Digging deeper, we tried to find out which symptom is most common. So we found out that anxious mood, tension, and insomnia were present in very severe category in around 40 to 50% of the population. Whereas other symptoms, somatic symptoms, respiratory symptoms, and cardiovascular symptoms were not present in most of the patient. CSER is because of the hyperpermeable nature of choroid, and it is also responsible for increased thickness in the fellow eyes. It is because of the corticotropin releasing hormone, which leads to stress. And in our study, we definitely we had a strong correlation between anxiety and CSER. To conclude, fellow eyes also have a thicker choroid, and thus the pathology is bilateral. Need for normative database is extremely important, which provides a platform for further research. And since it is a multifactorial disease, it requires a multidisciplinary approach and proper counseling. These are my references. Thank you.
Have you studied the recurrence of CSR in the patients having the high anxiety scores?
Sir, no, we took only treatment-naive first-timers. I took only treatment-naive first-timers in the study.
And the patients who are taking the anti-anxiety drugs, they are included, or?
No, sir. Just no. Means only first-timers we recruited.
Oh.
Undiagnosed, and what sir is wanting to know is whether they were diagnosed or treated for anxiety.
No, ma'am, no.
How long the anxiety is responsible for your detachment? Is there any time period?
Time period means all these were...
In a day, that you are tension in some you are not in a same level anxiety, na? Anxiety fluctuating. So is there any level of fluctuation or increase anxiety level, decrease anxiety level that may responsible your detachment?
We have not.
No.
Any acute exacerbation, say something like a stress factor.
Randomized. Means the all the CSR who were presenting first timers, we recruited those patients. Consider.
How you have calculated the sample size here? You have selected only 100 patients. Sample size,
Yes,
what method you have applied?
the
And you have said that 99 patients of the control, 99% of the patients of the control are not having any anxiety symptoms. But the incidence of, how you have selected the controls? Incidence of anxiety is more than 1% in the general population.
1% had mild anxiety. All
From
these,
where you have selected the controls?
the controls were presenting to the general OPD service.
Based on the scale.
Yes, ma'am. Yes, sir.
Corresponding measurements of the control group usage of the other eye you have given us.
Yes, sir. No, no, we have done. Choroidal thickness was normal in controls, and sub SRF nothing was present. Few patients of the control group had PEDs.
Okay, so we can go on to the